Good Saturday morning, everyone. Today on Perspectives, we hear how a local organization is working to make veterans' health services more accessible and efficient. Well, there's a large and growing veteran population in the southern market, which includes South Alabama. And many of our veterans are facing challenges in returning to a normal life after combat. To add to those challenges, a recent community needs assessment reveals that many veterans feel, though, that it's difficult to access the Veterans Administration VA healthcare services in Southwest Alabama. Now, nearly 3 out of 4 veterans are not receiving their benefits. 74% of the eligible veterans are not enrolled in VA healthcare, which could help them make a successful and healthy transition back to civilian life. Now, veterans responded to the assessment stating that what healthcare services that they feel are most difficult to access and the top reasons why they delayed getting needed medical care. The community needs assessment was conducted by Infirmary Health, USA Health, and Veterans Recovery Resources. Now, Veterans Recovery Resources, VRR, says its mission is to deliver the highest quality, compassionate, affordable substance abuse and mental wellness services to all veterans and their families who need help. Now, they are veterans helping veterans. Most of the organization's staff are former active duty military service members and combat veterans to accelerate the veteran well-being by removing barriers. Joining us here today from Veterans Recovery Resources, Colonel John Kilpatrick. He's the founder and executive director. And Dr. Jeremy Fletcher, Director of Community Integration for Veterans Recovery Resources. Promoting a culture of health among veterans on the Gulf Coast, Veterans Recovery Resources, we hear how they want to fill the gaps to meet our veterans' health needs when Perspectives continues after this quick break. This morning on Perspectives, we're talking about our veterans, and our guests this morning are from the Veterans Recovery Resources. As you may be familiar with, Colonel John F. Kilpatrick and Dr. Jeremy Fletcher. We thank you both for being here this morning to talk about some very important issues. And we're also talking about a lot of people in the reach of the program today who are eligible for veterans benefits. And yet there are some areas that we need to assist them in to get all of the things that they've earned, and at the same time figure out how to make sure that some of the other issues are resolved, because that's what you all have been doing in the years that you've been here active in the community to make sure that the needs are met. Because I guess in many cases when you started this, there were some things lacking. So let's talk about that this morning.
Well, for sure.
John, tell us again why you started VRR.
Absolutely. First of all, thank you for having us. We just are very grateful for what you do in our community, not only telling the story for us and our fellow veterans, but I know you're a veteran and it's near and dear to your heart. Yes. But you know, you do a tremendous service for our community, just getting the word out about the many different organizations that are serving our community, and we're very grateful for that. So appreciate you having us on. When we first started Veterans Recovery Resources, it kind of grew out of my own personal experience and then just trying to help other veterans find recovery and get treatment. And quite honestly, we thought it was a capacity problem. We just needed more treatment facilities in order to, you know, there just wasn't enough room for the need. And what we've set out to do was just remove the barriers to treatment, and whatever that is. And sometimes it's just a ride, sometimes it's the ability to pay for treatment. But what we've found over the years is the system is the barrier. And there's been, you know, numerous studies, and you know, why don't veterans engage, you know, in VA healthcare, and why don't they seek help? And there's a lot of different studies out there, but it's just not easy to do. And one of the statistics that we found in this community health needs assessment we did recently, we knew it, but we confirmed it through the study. Only 26% of Alabama veterans who are eligible are enrolled in VA healthcare.
In the system.
And so that just, you know, causes one to think, why is that?
What are you hearing? Why is that?
I think it's access. It's barriers. You know, they can't get there. They don't know how to get there. They don't. Maybe they don't trust the system. I mean, you know, you could ask 400,000 veterans, and you probably get 400,000 reasons.
And one of the reasons, though, is because Alabama, huge populations, South Alabama we talk about, because North Alabama, they have a VA clinic up there. But here we are in a population of nearly 70,000 veterans, and all we have is a clinic, I guess you could call it.
That's right.
And then, of course, major facility in Biloxi for the whole Gulf Coast, and then more facilities in Pensacola for that Florida contingent. But you're talking about a hotbed without a full service institution here.
I think that's right, Eric, and it's really the perfect storm. And so if you look at the way the VA organizes its health care for veterans, they're aligned by VISNs. You're familiar with that. Your viewers may not be. But Mobile and Baldwin County are aligned to VISN 16, which is based out of Mississippi. And the rest of the state is aligned
not Pascagoula, Biloxi.
Biloxi, that's right. The rest of the state is aligned to VISN 7, which is based out of Atlanta. And so there's that. But then you also have a state with the worst mental health care system in the country. And so when you get down to Mobile,
VA or inclusion of the
all
state
total,
resources.
yes,
exactly.
all total. So for veterans on the Gulf Coast, especially Mobile and Baldwin County, you kind of have the perfect storm. So you have a healthcare system, a mental health care system that's the worst in the country, and then many of the services that veterans in Mobile and Baldwin County need is over an hour away. And so you can imagine the barriers just to get there. So if you're a veteran in North Mobile County, that's a 2-hour drive to Biloxi.
Yes.
So if you have a job, I mean, you got to take off a day's work just to go to an appointment. And so there are provisions, and Congress passed the Mission Act to allow those veterans who, you know, so that they didn't have to drive more than an hour and they could seek care in the community. And our facility, Veterans Recovery Resources, we are a VA community care network provider. But we struggle to get the referrals.
You've been a stopgap since this organization was created.
We really have, and we, you know, that's been our mission. We care for anybody that walks in the door, and so a veteran, first responder, their family walk in our door, they're going to get everything we have to offer, regardless of their ability to pay. And then we, you know. And then we try to get paid because it's not sustainable. I mean, that's the bottom line. We're providing an invaluable service to veterans in our community, and you know, we only get paid for 20–30% of what we do. Yeah, that's not sustainable.
Right, that's not good.
And we've been able to close the funding gap with grants and charitable contributions. But long term, you know, we need to be able to get paid at least for, you know, half the work we do. We think we can be sustainable there.
So we've got some kinks that need to be worked out in the system. And how does Dr. Fletcher, you work in when you talk about community integration? Break that down to us. What exactly are we talking about when we say community integration?
Absolutely. So what we know is when folks come back into the civilian community, right? So there's a transitional process that happens there. And a lot of people struggle. Some people do really well with that transition, but some people struggle to adapt to this new culture and new environment that they're not accustomed to. So integration is essentially bringing people back into the community and returning them back to servants in their community, returning them back to meaning and purpose, the things that sometimes veterans are missing whenever they do transition back. So what that really looks like is plugging people into ways that they can do that. And so we've got many different programs under our community integration program umbrella that offers that ability.
Right. And both of you all understand that because you're both veterans as well as still involved actively in the Guard, or the reserves, I should say. And Dr. Fletcher also still reserve active.
I'm still in reserve.
And so you understand, and depending on what job you had in the service, it can make that even more difficult for some because some of those jobs are not transferable, so to speak.
Absolutely. If you're an 11 Bravo which was in the Army, an infantry person, and you were used to going on mission and coming back, and you know, there's not a whole lot of opportunities for 11 Bravos that are returning back. But yeah, so that's a part of what we want to do, and getting people back into meaning and purpose through occupation or employment or recreation, some ability to integrate back into the community, become a meaningful and purposeful citizen again.
Yeah. You know, we've got another segment, we'll talk more, but get into some of the services that you feel, some of the respondents that you're hearing from, the ones that are most difficult to access. You've got 6 here listed. What are those top ones?
Well, one of the things that we did, so you'll remember back in August of last year, we received a pretty substantial grant from the Substance Abuse and Mental Health Care Administration to create a certified community behavioral health clinic. And what that is the government's idea of integrated care in a community kind of designed to treat a particular population. And it was a perfect match for us because that's what we were set up to do from the beginning. And so what we know is that people don't recover in a clinic. You know, they often require clinical intervention, but long-term recovery depends on getting integrated back into the community and finding a support network that doesn't have anything to do with a doctor or a clinic. And so the CCBHC, the Certified Community Behavioral Health Clinic, that model is all about incorporating the community into that.
Hold on that point right there, and we're going to take a quick break.
Sure.
And when we come back, we'll talk more about the things that are needed, as well as how you plan on hopefully working around this bottleneck so we can make a difference continual for our veterans in this community. All right, well, Perspectives will continue in just a moment as we talk to our guests from Veterans Recovery Resources. And welcome back to Perspectives. We're talking to our guests from Veterans Recovery Resources, Colonel John Kilpatrick, in fact, we call him John, or JFK, I love your initials, and Dr. Jeremy Kilpatrick Fletcher from VRR. And we were talking about some of the research that was done to survey veterans in our area, and most, I guess, particularly wondering what ones are the most difficult sources for them to access. So what did you find? We started talking about the first one, the mental health services. Tell us if there's more to add about that, as well as some of the others that seem to be the most difficult.
Yeah, so mental health services was definitely the #1 identified community need.
And that's why you all are in business, right?
Absolutely.
Okay.
And it's what's interesting is within this study, this doesn't apply to just veterans. This applies to all of our community members. It's the #1 consistently identified mental health is that need. Over the last 15 years, that community health needs have been identified. The other is substance abuse treatment, access to substance abuse treatment. The other ones that are, I think, relevant for our particular population that we care for are things like transportation to appointments or other needs. And then one of the most interesting things that was mentioned was group therapy. Was another thing that was mentioned within the community health needs assessment. And
that's one of the things that you had incorporated from the beginning, if I'm not mistaken.
Yeah, it really is. And you know, the beauty of doing studies like this is, I don't know if it's the beauty, but you guess or you think you know, and you know anecdotally kind of what the lay of the land is. But when you do a study like this, it confirms what you know. And we didn't do this in a vacuum. You know, we partnered with Infirmary Health System and with USA Health to conduct this study. And so they also had a requirement to do a community health needs assessment, and we were able to kind of piggyback on them. And so it was a really broad look at the health needs in our community. And so like Jeremy said, a lot of the things that identified, we had some very specific questions for veterans, first responders, and their families, but a lot of what the study found is across the board.
Right.
And so it, you know, the difference is, or I think where organizations like ours succeed, is we're not just doing this study because we're required to do a study. We're looking at what people are telling us, and we're adjusting our programs to meet the needs
to do it better.
Of what our community says they need.
Right.
Absolutely.
That's the key.
And on this, you also identified from the respondents why they delayed in getting their services.
Yeah, it's It's baffling, really, but and again, that's the general population. But veterans, I think I've told you this on our show. We don't like to ask for help. We're the helpers,
right?
And so, when we ask for help, it's way late. We've already exhausted everything. Many have lost their family, their jobs, their homes because of their stubbornness and willingness to ask for help. And so, the bottom for veterans and first responders too is pretty low because we don't ask for help.
But sadly now we have too many that are taking their lives.
Well,
so that's
exactly.
we want to prevent that from happening.
That's exactly right. And when we ask for help, especially the veteran first responder population, it's already too late. And so to be put on a waiting list or be delayed treatment because there's no capacity or they can't get in or they don't qualify, those are all things that will lead someone to the hopelessness it takes to take their own life. Because for a veteran first responder to ask for help, they have to be hopeless. They've given up. And that's required. That hopelessness is required to recover. And if they get the help they need, there's a really good chance they're going to recover and stay recovering long term.
Now, the word's out there about you guys. Are they coming to you now to where you've got, okay, because I know it's been a process, of course, but usually this kind of word gets out there.
Yes.
It has, and I want to add a couple things there on that, because we've done a great job of as an organization going out in there and doing some really informal contacts through a lot of our community programs. We have Dr. Charles Dent as our clergy outreach coordinator. He goes out and develops a lot of relationships with other nonprofit organizations, as well as a lot of ministers and faith-based organizations to tell people about our services, and then also to sort of bridge the gap between those two places. Mental health and clergy have often had some disconnect over how they care for people in their time of need, and we're trying to build some bridges there.
Now, he's also a veteran, isn't he?
He is also a veteran,
okay.
yes. Yeah, Dr. Dent's a Marine. He reminds us that all the time. Yes. And yeah, so and then we have another program that's called Helping to Overcome, which is an aquatics-based program, or H2O is the short term for it, and they do a great job of going out into the community, making those connections through aquatic-based activities, whether it's scuba diving or fishing, and just building the opportunity for people to build relationships and connect with one another. So
and that's one of the
really
things that we lack when we leave the service sometimes, that sense of family and camaraderie.
That's right.
You lose it in many cases when you go out into the
And that's another factor
world
that plays into this suicide problem, right? So we've got, in our work on the Alabama Governor's Challenge, which is the initiative at the state level to be able to make an impact on veteran suicide. We know that when we improve what's called social connectedness, that we're going to have a reduction in veteran suicide. So that's another part of our programs.
We've got about 2.5 minutes left. Tell us what we need to do to help VRR get past the hurdle and the bottleneck that's stopping the funds, I guess you could say, flowing in for those who you're treating and serving.
Yeah, the best way to sum that up, Eric, is if you're a veteran and you're not living your best life, and you're not where you want to be, I would say come see us, because we can probably help. If you're a veteran, first responder, and you are living your best life, you need to come see us because we need your help. The immediate needs for Veterans Recovery Resources right now is not funding. For the first time in our history, we literally have enough money to do the work that we're doing. So our detox and residential facility is under renovation now. We hope to open it in April of 2023, and we have all the funds we need to build it.
Excellent.
We've got some startup money to start hiring the staff for that. So over the next 3 years, we'll need to raise about $7 million for the operational startup cost for that detox and residential program. Our outpatient program through the CCBHC grant is fully funded for the next, we've got another 15, 16 months on that grant, and a kind of a clear path to sustainability. I mean, what we need is folks to get the word out, and if you're not, if you need help, come, and if you can help, come. Yeah. That's it. I mean, I think the long-term success of Veterans Recovery Resources is not going to be based in our clinic or our treatment center. It's going to be our impact on the community, because what we're really doing is taking folks who, for whatever reason, are unemployed, unemployable, and really not participating, and we get them on a path to becoming full-fledged members, active members in our community. And we know from the research, I mean, your career, good sign. I mean, look, I was one of those guys, and here I am running an organization that's really changing the world. Same with, we engage at a level much higher than our civilian counterparts.
Well, tell us, as we're wrapping up here, where do we find you and where you're located and how to reach you?
Absolutely. So our clinic, the CCBHC clinic, is located on Spring Hill Avenue, 1156. We're right on Spring Hill Avenue, right in Midtown. The residential and detox facility is right next door, 1200 Spring Hill Avenue. You can find us on the internet, vetsrecover.org, and you can call our line. We answer that phone 24 hours a day with a veteran, 251-405-3677.
Colonel John Kilpatrick and Dr. Jeremy Fletcher, we thank you both for what you're doing. Continued success in that, and of course, we're going to make sure we get the word out there for you.
And we appreciate it. Thank you very much.
Thanks
for having us.
Appreciate it.
And for more information, you can contact Veterans Recovery Resources. Their office, as mentioned, is at the address there at 1156 Spring Hill Avenue in Mobile. And they are open Monday through Friday, 8 a.m. until 6 p.m. They do offer appointments now when needed at other times. The number to call, 251-405-3677, and the website, vetsrecover.org. Well, please join us here next Saturday morning at 9 for Perspectives as we discuss those important issues and seek solutions. I'm Eric Reynolds. Thank you so much for joining us today. Have a great week ahead.
Thanks for watching Fox 10 News. Watch us live wherever you are, on our mobile, our streaming news app, and you can also watch us on Roku, Apple TV, and Fire TV.